In this session, we're going to look at a warm-up for a client with osteo and rheumatoid arthritis. The type of equipment I've used with Sandra here is an elliptical walker because it gets the whole body warmed up, the upper body and the lower body, and it's less stress than the joints. The recommended time, the minimum time, is going to be 10 minutes for a warm-up. We do need an extra warm-up on the joints, and it is a gradually slow build-up. The rate of perceived exertion will be between starting at 7 to 11, so extremely light to light. Just keep in mind, if you do choose another piece of equipment, make sure it gets the whole body warmed up rather than just, for example, the legs or the upper body. We're going to look at dynamic stretching for osteo and rheumatoid arthritis. The recommended stretch that I've got Sandra here doing and is recommended is dynamic stretches. So you see Sandra performing dynamic arm swings and she's doing it under control. She's gradually increasing the range of motion every time, and I'm talking to her constantly and making sure that there is no bouncing going on. Ballistic stretching is not appropriate for this type of client. Each stretch, each set should take about 8 to 10 repetitions, and the set itself should be between 15 and 30 seconds in total. You want to gradually increase the intensity each time and for the client to go further into the stretch. The good thing about dynamic stretching is it prepares the client for what they're about to do in the session, but it also mimics real life. So it is a good idea to get this client to do that throughout their week and to encourage them to make sure that they're dynamically stretching, possibly in the morning. Alternatives, you can adapt this. What you see here with Sandra, she's doing a squat. Well, then she could do heel flicks. She could do, for the core rotation, she could just do a static stretch with it. For the chest, for example, to replace the dynamic arm swings, she could do an active chest stretch. If she's finding it sore on her feet, she could do the seated hamstring stretch rather than what she's doing here, which is a dynamic hamstring stretch. So we're doing resistance training for osteo and rheumatoid arthritis in this part, and I've chosen a bodyweight exercises. The benefit to bodyweight exercises, they can be performed by this client at anywhere and any time without any major equipment. So they really just need herself. There isn't any clear data. The data is insufficient when it comes to resistance training for osteo and rheumatoid arthritis. So it should always be tailored to the person, and it should be for the person to be able to perform everyday tasks. So we should be looking at functional training, and that's why I've chosen squats here and I've chosen lunges for the next exercise. The repetitions should be anywhere between 5 to 15 repetitions, and I've went for 70% of a 1 rep max, but it is not appropriate to do a 1 rep max test on a client with rheumatoid and osteoarthritis. It needs to be a gradual increase. We want to be performing multi-joint movements, so that's why we're choosing functional training here. It's best to avoid isolated exercises because we want to spread the load of resistance over the joints, and we want to avoid impact exercises. What you see me doing here with Sandra with this exercise in the tricep is to work her hamstrings, and we're doing a single leg deadlift, and this is to improve her balance. So it's very important to do balance exercises with clients with osteo and rheumatoid arthritis, and it also gains confidence as well. Onto fixed resistance machines for a client with osteo and rheumatoid arthritis. The benefits to fixed resistance machines, well, they are highly adjustable, and that is a benefit for a client with osteo and rheumatoid arthritis. They can get into the position, the perfect position that they need to get into and you want them to get into, and they can do it easily. The intensity can be increased gradually with this type of equipment, which is also a good thing. And for a client that is just new to the gym, new to exercise, It is very easy to use. The downside though, they do not mimic everyday life. So because of the nature of the equipment, it does fix you into a certain position. So in this session, we're going to look at a cardiovascular workout for a client with osteo and rheumatoid arthritis. I've chosen the recumbent cycle for Sandra, and Sandra's session here is going to be 10 minutes. You can get anywhere between 5 to 20 minutes. That's what the recommendations are. So a 5-minute session and gradually increasing it over time to a 20-minute session. It should be a combination of low to moderate weight bearing activities such as walking, non-weight bearing, for example, cycling. And you can also get partial weight bearing. So something you could do is, in the client's SMART targets, incorporate them to join an aqua aerobics class, which really takes the pressure off the joints. The rate of perceived exertion should be, on the board scale 6 to 20, 11 to 12, which is light. I'm going to look at free weight resistance training, and what I've chosen is a tricep with Sandra here using dumbbells. I've chosen the bench so that she's in the same position and she doesn't have to move much between each exercise. Having said that, I will get Sandra up and moving about between sets, and the reason for this, it does loosen off the back. For example, she is stuck in the same position constantly and there can be stiffness there. We could introduce a gym ball into the equation rather than the bench. The benefit is it does work joint stability, and that's the benefit to the free weights. The free weights do work and challenge the client's joint stability, but then we start to introduce a risk of falling. So we've got to really closely monitor this client, whether on a bench, on a gym ball, or such like. It's very important to watch for good posture with free weights because they are a bit more unstable than the fixed machines. However, they do copy more like real life movements. So what we're looking here is perturbation training for osteoarthritis, and the goal here is to increase joint proprioception, improve the joint stability, and also help reduce the risk of falling. It's great for a client who's got osteoarthritis in the knees and the ankles and there's an instability there. And this is a good way of getting the client to react to an uncontrolled movement. So it's all about reactive balance, and what I've got Sandra doing is performing exercises here, daily exercises that she would possibly carry out in her normal life, and I'm going to gently pull on her hips and she's got to react and keep her joints and her body still and stable. As you can see here, I'm using a Percussive ball. One foot's on the ball, one foot's on the step, and I'm gently shoving her shoulders, and again she's got to remain still here. So we're now on to the cool down stretching, and this is a seated hamstring stretch I'm doing with the client. Very important to get the posture right, to get the lines of the body right. For example, the foot, the feet, the leg in a line. The client isn't stooping over. I'm using a resistance band here, a very thick resistance band, and this can assist the client to get a good stretch but not stoop with her shoulders. The stretch itself, well, stretches when we're doing cool down here should be between 5 to 8 seconds per individual movement. We want to aim for about 1 to 3 repetitions. So as she pulls on it, she'll hold it for 5 to 8 seconds and then move hopefully into the stretch. But you do base this on the client, and you're listening to the intensity through the talk test, through chatting to the client, that they're not in any discomfort at all. It's recommended that we do the cool down stretches and developmental stretching every 1 to 2 times a day and over 3 to 5 times a week. It should always be within the pain-free range of movement, and we should progress to a graded exposure to pain. Other recommended stretching could be Tai Chi and yoga. They're excellent for a client who's got osteo and rheumatoid arthritis for developmental stretching. So we're now on to the final session, and this is a cool down for the body. I've chosen the stationary bike here. Again, you can choose any piece of cardio equipment you like that suits the client and doesn't do much impact on the joints. The session cool down I've chosen for Sandra is 5 minutes, and the rate of perceived exertion is going to be from 11, so light, to a 9, extremely light. This is a good chance to catch up with the client and find out how the session went, how she enjoyed it, what worked, what didn't work,